Welcome to the axial skeleton. The axial skeleton is made of the bones of the head and trunk, and it forms a longitudinal axis of the body. The appendicular skeleton we will talk about in the next unit, and this is the bones that support the limbs. So basically, that is everything else. Before we totally get into this lecture, I want you to make sure that you get your Unit 1 outline, which is the sheet of paper that has all of the lists of all of the bones and the markings. And then also, I would like you to get your anatomy sheet and have that near you so that you could fill this out as you go. All right, so we're going to start here, and this is why I want you to have this right in front of you. You can pause this video and you can fill out this diagram. Make sure that you have the correct diagram. You might have two packets that look like this, so you might need to flip the page and make sure that the page under this is only dealing with the skull and the vertebrae. So as you can see here, the axial skeleton is made up of the skull and the associated bones, the thoracic cage, and the vertebral column. So this tells you this, skull and associated bones, the cranium, the facial bones, the auditory ossicles, the hyoid. The thoracic cage is your sternum and your ribs, and the vertebral column are the vertebrae, the sacrum, and the coccyx. So please pause the video if you need to fill out your packet now. All right, so a little bit more in depth on what makes up the axial skeleton. And again, I will let you fill out your packet. You only want to have the axial packet in front of you. So the skull, here's the ribs, here's the vertebrae, and this is the lumbar vertebrae that you're seeing here in the anterior view, the sacrum, and the coccyx. I'm just going to give a general overview right now because we'll get into this more specifically. You can see the sternum and the ribs. You can also see the posterior side where you can see more of, you can there see the cervical vertebrae and the thoracic vertebrae. All right, so it goes cervical, thoracic, and then the lumbar vertebrae. It goes C7, T12, L5. All right, the axial skeleton has 80 bones. All right, in the skull, there are 8 cranial bones and 14 facial bones. The bones in the skull, there's 6 auditory ossicles used for hearing, and the hyoid bone. The thoracic cage has the sternum and 24 ribs, and the vertebral column has 24 vertebrae, the sacrum, and the coccyx. Before we get started looking at all of the different bones, I want to make sure that we go over the functions again of the axial skeleton. Obviously, those bones we talked about, a big one is support and protecting the organs in the body. Also, there's parts on these bones that allow for attachment of muscles, allows our head to be positioned, our neck, our trunk, allows breathing, movements. You're going to see with the skull, we can move our head back and forth. We'll get talking about that. And then also helps stabilize all the other parts of the skeleton, which are the appendicular skeleton. The facial bones. The facial bones, there are 9 facial bones, and those are for muscle attachment. Then there are 5 deeper ones that help separate the oral and your nasal cavities. The deeper ones help increase the surface area of the nasal cavity and help form your nasal septum, which is a division in your nose. All right, the first thing we want to get started with are sutures. And the sutures that you have to know are the lambdoid suture, it kind of looks like a lambda symbol. The coronal suture, I think of crown. Sagittal suture, think of left and right sides. Squamous suture and the occipitomastoid suture. So when you go to your sheet, and I'm going to pause here for a second to make sure you have your outline. And so before I get started, I'm going to have you highlight the what we're going to be talking about. So let me go to this diagram here. And I only have part of it here. You have a big unit outline. So I want to make sure that whatever you see highlighted in green, you go ahead and highlight that as well. And you can highlight as we're going, or what I can do is I'm just going to scroll here a little bit, and then maybe you can go ahead and highlight, pause the video. But you can see that we have the concepts and the topics. And so, for example, we have sutures here. These are the sutures you have to know. Cranial bones. These are the cranial bones you have to know. Now, landmarks, you can see there's a lot more, but you don't have to learn all of those or be responsible for all of those as you normally would, since we are short on time due to COVID-19. So I'm just going to sit here for a second, and if we will go over this in class as well, but if you wanted to look at this again, this video again, you could do this again and again and again, and I will just simply scroll right now. These are the 2 columns of your Unit 1 outline that we are going to be focusing on. So the only thing that we have a little bit lower there, when we go to the landmarks, that's the orbit, that bottom one. And then when you go to the end, there aren't any more. So you want to have that handy, because also something that you can do is you can write down with those landmarks, especially, those are those markings. You can write down, oh, the foramen magnum, oh, that is, located on what type of bone. That will be important. That'll be helpful to you. Okay, so I have that sheet right next to me too. And so we're going to take a look at those sutures. So hope you can see my arrow here. Actually, I can use the pointer. So the sutures, major sutures of the skull here, the sagittal suture, the lambdoid suture, and the squamous suture. All right, so here, these are these sutural bones. This is going to be the sagittal suture. Okay, so dividing right and left. And as I go through this PowerPoint, you should be basically staying with your packet as well. And so this is going to be, this is a posterior view. So the back of the head is where that occipital bone is, and then those parietals. So you're between the parietal bones, there's a suture, and that's the sagittal suture. And then if you go down and then you go along the back, that suture right here is a lambdoid suture. And then here, this is the squamous suture. So we're going to get a better look at this in a second, but you'll be able to see between the parietal and the temporal bone. Now, there's some other things you have to know on here, but right now you should be trying to learn the sutures. Okay, so this is a superior view. Okay, so we're kind of looking down. So the frontal bone is right here. And then this is the coronal suture right here. And that I always think of like your crown. Okay, so this is the coronal suture. This is where your frontal bone comes together with those parietal bones. There again is your sagittal suture. And you can see a little bit of the lambdoid suture as well. Now, this lateral view is a great one. We'll come back to this a lot because we can see a lot of the bones from the lateral view. But here we're focusing on the sutures. So the coronal suture, you can see right there. Sorry. The coronal suture is right there. And then here's that squamous suture. This is part of that lambdoid suture. So you can see this squamous suture here, that this is your parietal bone. This is your temporal bone. And so there's that suture right here. And so the only one that I don't think that we can see is it's going to be, there's a suture right here. Whoops, right here. And this is going to be your occipitomastoid suture. So it's called that because here's the occipital bone, and this is the mastoid process, as you can see right here. And so if you go behind your ear and you roll your finger down, you should feel like a bump there. That's the mastoid process. So this is the occipitomastoid process. All right, so if you look on your sheet, coronal suture, lambdoid suture, occipitomastoid, sagittal, and squamous suture. We have your sutures done. All right, so the cranial bones. We have your ethmoid, your frontal, your occipital, your parietal, your sphenoid, and your temporal. So we have seen a bunch of these, and I wouldn't spend all of this time like filling out every single thing on here, but we can see like what you should label. And I know you have the same diagram. It's the next one in your packet. You want to just focus on learning the bones as we go. So frontal bone, hopefully we can get that down. All right, the sphenoid, I'm going to show you that as well, but this whole part right here, this is the sphenoid. And the sphenoid looks like a bat, but we're going to get there. But hopefully you can see right now, I want to point out that that's going to make up part of the orbit of the eye's orbit. The eye is made up of several bones, and there's fissures in there. On this diagram, we can see some parietal bones. And let's see, occipital we cannot see because that's in the back. Your temporal, you can see it's here in red, but it's better from the lateral view. The ethmoid is going to be, you can see it here. The ethmoid is it's like this part of this green part right here, this green and this green, and it looks like a bug. So we're going to get back to that. And then I think we need to get to a different views to see the other bones. Yes. So here you can see that occipital bone, and you can see more of the temporal bone. And then here I want to point out, here's that sphenoid, that purple, and we call it a bat. And we'll look at another one, but that is the sphenoid bone. All right, so you have the ethmoid, which is like more in the nose, and I'll point this out again, but this purple sphenoid here, you should be able to see that it's kind of like a bat, and it is like a keystone bone. It holds, you know, a lot of the bones of the face with the skull. All right, so this is just showing you the cranial cavity. All right, so here we have a sagittal section. I was doing a sagittal section to the picture. So a sagittal section, and you're looking at this, it was taken just lateral to the nasal septum. And this just shows you the different cavities. So you can see your frontal bone, your parietal bone. This is going to be the temporal bone, and this is going to be the occipital bone. And you can see some of the sphenoid here and some of the ethmoid bone. And then this is looking at the floor of the cranium. This is a superior view. And so this, you know, this is going to show you some important landmarkings. Like, so for example, here's our occipital bone, and here is the foramen magnum. Very important. opening for the medulla oblongata. There's a lot of different nerves that pass through here into the spinal cord. All right, but you can see the different cavities within the cranium. All right, I do want to touch on your sinuses, and we'll get to the paranasal sinuses at the end here. But sinuses are air-filled chambers of the skull, and they decrease the weight of our skull, and they have mucous membranes that help moisten and clean our air. Sometimes if we're sick, they get clogged and we get all nasally, and that's what's happening. They help. And when you're sick, you might sound you sound stuffy, and sometimes that nasally sound is appealing to some people. So sometimes when people sing, that tone is like, I've heard singers have said, I wait till I have a little bit of a cold to get a certain sound. So it is involved in speech production. I don't like being nasally. So for me, no, I don't want that at all, but I can't sing, so. Okay, I touched on these cranial bones. We're gonna go a little bit further. I'm going to keep going. Actually, let me go back. I'm sorry. I want to go to your occipital bone. So I want you to remember that this is your occipital bone right here. And if you look on your sheet, you have a foramen magnum and you have occipital condyles. So the foramen magnum right here, that is a you must know. And so right now on your sheet, you want to identify this one, okay? And you want to make sure you know that this is part of the occipital bone. And all the nerves are going to go from the brain to the spinal cord here. And then the other marking that you need to know, and in class, you need to find these. You need to touch these with your hands that you have gloves on, and you need to make sure you can find it. This is on the occipital bone. This is the foramen magnum. And then here, these are the occipital condyles. And so you should be able to feel those. And those articulate with our vertebrae, okay, our cervical vertebrae. They allow us to do things like yes. All right, so their condyles are involved in articulations. All right, so that occipital bone that I was just talking about joins with parietal, temporal, the sphenoid, and like I said, that first cervical vertebrae, which is actually called the atlas. So here again are those two markings. I've highlighted them for you, the occipital condyles and the foramen magnum. So if you want to pause the video and try to get those down, there are a lot more, but just make sure you know that these two are with the occipital bone. The frontal bone, that's the anterior part of your cranium, okay, and it makes up the roof of your eye socket, and there's also frontal sinuses there. So you might, remember, you might like put pressure on that frontal bone sometimes if you have a headache. It joins with the parietal, the sphenoid, the ethmoid, the nasal, the lacrimal, the maxillary, and the zygomatic bones. The next bone are the temporal bones, and the next bone, I should say, excuse me, is the temporal bone. And there are two processes that you have to know for the temporal bones. And for the temporal bones, it's the zygomatic process and the mandibular fossa. Look at all these other ones. Okay, so let's take a look at, here's your temporal bone, so right here. And let's see what you have to know. Now I'm going to point something out. Kids have a hard time with this. Here is your zygomatic process, this right here. So you can see it goes to here. So this blue bone here is the zygomatic bone. And the zygomatic bone is your cheekbone. Okay, so you can even feel along as you go towards your ear, and you can see like right here, this would be your external acoustic meatus. Okay, this is going to lead to your eardrum. So you can even go like right along with your ear, and you can feel this is the zygomatic process of the temporal bone. You can see it's red. Often kids want to say, oh, if it's a zygomatic process, it must be of the zygomatic bone. Makes sense, right? It's tricky. Anatomy is tricky. So this is the zygomatic process, but it's on the temporal bone. Now, it's not labeled here, but the other thing that you have to know is a mandibular fossa. So it is right here, okay, but we're going to look at this on another slide. Let's see, right here. So there's this depression, and I'm going to go back so you can see that, but it's on the temporal bone. So it's right here, and so you can see that this right here, this is your mandible. So that is your jawbone. And a lot of times when you go to the dentist, they say open and close. So this part here, this part here is a condylar process. And this condylar process fits in with the mandibular fossa. Okay, so that the joint fits together. And those are two bone markings you have to know, but we will come back to that. But it's that mandibular fossa is on the temporal bone. The sphenoid generally forms the floor of the cranium, and like I said before, it's a keystone. It brings together the cranial and the facial bones. It strengthens the side of the skull. Look at all these joints here: ethmoid, frontal, occipital, parietal, temporal, palatine, zygomatic bones, maxilla, and the vomer. All right, all of these different bones. Here's what it is. It looks like a bat. All right, so you can see that it has the wings. You do not need to label all this. You should look at this, and this is a sphenoid. We have a disarticulated skull that you can see this whole thing. And if you look at the skulls that's colored, it's easier to see, but it's more difficult on some of our other skulls. So this is just another anterior view, the anterior surface of the sphenoid. So you can see here, if you're looking in the orbit of the skull, you can see what it looks like. So here's that purple again. Like I said, it looks like a bat. Looking for from the inferior view. Your ethmoid, to me, it looks like a bug. So I always refer to it as a bug. And this forms the anterior medial floor of the cranium. I always think nasal cavity. This makes up the nasal cavity because it does. It makes up the roof. It's part of the nasal septum. And the medial also makes up part of the orbit. And it has a bunch of cells that make up some of the sinuses. And it joins with the frontal, the sphenoid, the maxilla. Maxilla, you guys, is your mustache bone right here. Nasal, lacrimal, those are going to be right here. Palatine, the inferior nasal conchae, and the vomer. These are just some other structures that I'm just going to go ahead and skip through, but here's what it is. It looks like kind of like some kind of bug or insect to me. So, you know, this could be like, I don't know, this could be the proboscis, these could be kind of like wings, this could be the head, I don't know. To me, it looks like some kind of bug. Okay, we are going to finish off with the facial bones and the hyoid bone. All right, so these are the maxillae, the palatine, the nasal bones, the vomer, the inferior nasal conchae, the zygomatic bones, the lacrimal bones, the mandible, and the hyoid. The maxilla is I say the mustache bone. So this supports your upper teeth. They form the lateral margins of like your external nares or your nostrils. They form up your upper jaw and most of your hard palate. So if you put your tongue up to the roof of your mouth, you can feel like in the front is the soft palate and the back is your hard palate. And then they contain your maxillary sinuses. And it joins with the frontal bones, the ethmoid, and with one another. And all of the facial bones except for your mandible, which is your jawbone. There are fissures within the maxilla that we're not going to cover. So here you can see this is the orange bone here. That's the maxilla. And I am going to point out some of these other bones while I'm right here. So you can see that there's the nasal concha and there's different parts of it, all right? But looking in here, you can see that part right here, this is the nasal concha. And when you look in the skull, you'll have to find these. And concha is like, it is kind of like reminds me of little pieces of a shell. The conch, you can think of conch like with this shell. So this is the middle nasal concha. You can see that that's, in towards, in the nose area. The nasal bone itself is right here. The lacrimal bone, it's like, where's the lacrimals are right here. It's not the green. The green is the ethmoid. It's more of like that reddish color right there. So you have your nasal bone, and then you're going to have your lacrimal bone. And let's see what else I can show you on this page. Well, just so you're aware, like this is the nasal septum, and part of the nasal septum is your ethmoid, but then the vomer is right here. But I think the vomer is really easy to see in a different view. If we look inferiorly at the vomer, I think that's a little bit easier to see. The palatine bone, they form the posterior portion of the hard palate. Okay, so and this also, so it's weird. You think of your hard palate and the back of your mouth, and then this bone forms part of your orbit as well. Your nasal bones, that's supporting the bridge of your nose. So again, there's a nasal bone. Here's the vomer. Here's a palatine. These are tricky. I think the palatine is really hard. It's that yellow right here to see, but it's good to take time to make sure you have these labeled on your sheets. The vomer. The vomer is the inferior portion of your nasal septum. And I want to get to this view here to show you the palatine bones and also the vomer. So here's the palatine bone right here. So remember, in the back, this is making up the back of your hard palate. So you can see like what makes up your hard palate. Okay, the maxilla, and then the vomer. I'm sorry, the palatine bone. I'm getting ready to talk about the vomer. These are the hard palate. My fault, you guys. The hard palate is the maxilla and the palatine bone. So this is the palatine bones right here. The vomer is right here. So see this gray structure? This is the vomer. So you can see that better from the inferior view than you can. Here's the vomer right here. Okay, and then the palatine is right here. So the inferior view is definitely, here's your vomer, here's your palatine bone. It's a lot better. Your nasal conchae, they help slow the air that you inhale. They create air turbulence inside the nasal cavity. and they help increase that epithelial surface area to help warm and humidify the air that you breathe. So I pointed these out before. There's an inferior right here, and then there is a middle right there. The vomer is going to be here. So if you're thinking about what are these, you know, this is going to be your nasal bone, okay? This right here, this and this are going to be concha. Conchae. So this is going to be middle, this is going to be inferior, and then this is going to be your vomer. The zygomatic bones are your cheekbones. They form parts of the zygomatic arches, and they contribute to the rims and the lateral walls of the orbit as well. All right, so the lacrimal bones I have pointed out, they are the smallest facial bones. So they were kind of really hard to see. They are part of the orbit. So let's find them. So it's like, here's your palatine, here's your ethmoid, and then there's a lacrimal bone. So you have your nasal bone, and then you have part of your maxilla, and then there's going to be a lacrimal bone right there. So here you could see a different view of the lacrimal bone. Here's the vomer. The mandible, that is your lower jaw. And it articulates with the temporal bone. And so here's your mandibular, the mandible. And here, let's see, condylar process we have to find, which is right here. That is on your Unit 2 outline. This is the head. So here's the mandibular knot. So this again, the articular surface here. So remember that mandibular fossa of the temporal bone. So you can see the jaw is going to fit in there. When you have the skull in front of you, you need to look at this and you need to find the condylar process. Okay, you can see how the head will go right in that mandibular fossa. Remember, the mandibular fossa is on the temporal bone, right? Not on the mandible. So I like to point this out, like the temporomandibular joint, or TMJ. Your dentist checks for that, okay, to make sure everything's okay. So that is a joint that we are going to learn in this class. So I want to point that out so you are familiar with it. And this is just another view. This is the condylar process. This is the surface of it. And this is what's going to, this part here goes into the mandibular fossa. The hyoid bone. The hyoid bone is kind of weird. It supports the larynx. Okay, the larynx, when it's thickened and mature, that's your voice box. And also in males, they often have a more pronounced larynx, the Adam's apple. So this attaches muscles of the larynx, the pharynx, which is your throat, and your tongue. There's a stylohyoid ligaments that connect the horns to the styloid process of the temporal bones. We're not making you know those markings, so you don't have to worry about that too much. All right, so here is where the bone is. So you can see the hyoid bone. So you'll just have to know when you see this bone, that's the hyoid bone. Now, you heard me say there's all these bones that make up the orbit. All right, so 7 bones of the orbital complex form each orbit. So you have the roof of the frontal bone, the floor of the maxilla. You have your maxilla, the lacrimal bone, part of the ethmoid, the sphenoid, the palatines, and the zygomatic bone. So I like this picture because I just like you to see, here's your orbit where your eye is, and here are all those bones. Here's your zygomatic, Here's the sphenoid. Here's the frontal. Here's a little bit of the ethmoid. Here's that lacrimal bone. Here's the maxilla. So all of these bones make up the orbit. And this is just another view. And you'll have to get better at looking at the skull that is not color-coded. This is just a sagittal section. Seeing the nasal septum removed, so you can see different features of the nasal cavity. I don't think you guys have this in your diagram, so I'm just going to go ahead and skip that. And the last thing I want to talk about is your sinuses. Again, they lighten the skull. They release mucus into the mucus cavities. And this is your last diagram that you have to fill out. So your frontal sinus is right here. And that should make sense because that's where the frontal bone is. The ethmoidal cells right here. And that makes sense if you know where that is. The sphenoid ones, that for me is where I get the headache, the sphenoid. I can even push on it and feel pain right now. And then your maxillary sinuses are right there. While I'm on this, I will go over the fontanelles. The infant skull. Baby skulls, they grow rapidly. And if you look at a baby's head, it's really large compared to the body. There's many places where it ossifies. And fontanelles are, when the bulbs are fusing together, what's left over, you see that suture. Okay, it's not complete at birth. Okay, so within the 2 frontal bones and 4 occipital bones. So it's interesting. So the back of their head and in the front, there's you can sometimes feel a soft spot. Those are the fontanelles. There's also several sphenoid and temporal elements as well. So what I was saying about those soft spots, those are those large areas of fibrous connective tissue. They cover the unfused sutures of the infant skull, and they're there because it allows the skull to flex during birth. Okay, guys, there are some pictures of them from a lateral view. So right here and right here. And then you can see here's an anterior one, and here's a posterior one. And that is where we're going to stop. All right.